Hello, this is Dr. Anbui with Cypress and Fairfield OBGYN. So we're going to talk about labor induction at 39 weeks.
Hi, Dr. Bui. What is labor inductions?
Labor induction is the use of medication or other method to induce or start labor.
Why is labor induced?
Labor is induced to start contraction of the uterus for vaginal birth. Labor induction may be recommended when there are certain concerns of the health of the mom or the fetus. It may be recommended when labor has not started on its own.
Are there other reasons to have labor inductions?
Yes, in addition to some condition in which labor induction is recommended, new research suggests that induction for healthy women at 39 weeks in their first full-term pregnancy may reduce the risk of cesarean birth.
Why would I want to avoid cesarean birth?
Cesarean delivery is surgery and comes with certain risks, including bleeding, infection, injury to bowels and bladder, longer recovery time than a vaginal delivery. Cesarean delivery also increases the risk for future pregnancy, including placental problems, rupture of the uterus, and of course a hysterectomy.
Can I have inductions at 39 weeks?
You and your OB/GYN and our other health professional can talk about induction at 39 weeks if, number one, this is your first full-term pregnancy, two, you're carrying only one fetus, and three, you and your fetus are healthy.
Can inductions be done before 39 weeks?
When a woman and her fetus are healthy, induction should not be done before 39 weeks. Babies born at or after 39 weeks have the best chance of healthy outcome compared to babies born before 39 weeks. When the health of the woman and the fetus is at risk, induction before 39 weeks may be recommended.
Will my hospital offer inductions at 39 weeks?
Your hospital may offer induction at 39 weeks if it has the staff and resources to do so. If your hospital offers other options, your OB/GYN and other healthcare professional will coordinate that care with the hospital staff.
This is my first full-term pregnancy. Why else would I consider induction at 39 weeks?
You might consider induction at 39 weeks to reduce the risk of certain health problems. Healthy women whose labor is induced at 39 weeks have lower rates of preeclampsia and gestational hypertension than women who do not are induced at 39 weeks.
How is inductions done?
There are several methods to start labor if it has not started naturally. The way to start labor may include the following: ripening of the cervix, stripping the membranes, oxytocin, and rupturing the amniotic sac.
What is the ripening of the cervix?
Ripening of the cervix is a procedure to help the cervix soften and thin out so that it will dilate or open during labor. Before inducing labor, your OB/GYN or healthcare professional may check to see if your cervix is ready using a Bishop score. With the scoring system, a numbering from 0 to 13 is given at the rate of the condition of your cervix. A score of 6 or less means your cervix is not ready for labor. If your cervix is not ready, ripening may need to be done.
How is that procedure done?
So it's done in the following way. You can use medication that contains prostaglandins. These drugs can be inserted in your vagina or can be taken orally by mouth. Or we can use a thin tube that inflates a balloon at the end. This tube is inserted into the cervix and then expand. This will help widen the cervix.
What is stripping the membranes?
To strip the membranes, your OB/GYN or healthcare provider will sweep a gloved finger over the thin membranes that connects between the amniotic sac and the wall of your uterus. This is also called sweeping the membranes. This action is done when the cervix is partially dilated and can cause your body to release its natural prostaglandin, which will soften the cervix and may cause contractions.
What is oxytocin?
Oxytocin is a hormone that causes contractions of the uterus. It can be used to start induction to speed up the labor once it is already on its own. Contraction usually starts about 30 minutes after oxytocin is given.
What is rupturing the amniotic sac?
To rupture the amniotic sac, an OB/GYN or other healthcare provider make a small hole in the sac with a special tool. This procedure is called an amniotomy and can be done after a woman has been given oxytocin. Amniotomy is done to start labor when the cervix is already dilated and thin out and that the head has moved down into the pelvis. Most women go into labor within hours after their amniotic sac or their water breaks.
So what is the risk of labor inductions?
With some induction method, the uterus can be overstimulated, causing it to contract too often. Too many contraction can lead changes to the fetal heart rate. Other risks of cervical ripening or labor induction can include infection to the woman or her fetus.
Is labor inductions always effective?
Sometimes labor induction does not work. Early labor is the time when the woman's contraction starts and her cervix begin to open. Some women who are induced at 39 weeks should be allowed at least 24 hours or longer in the early phase of labor. They also should be given oxytocin at least 12 to 18 hours after stripping the membranes. If a woman's labor does not progress, it may be considered a failed attempt at induction.
So what happens if induction doesn't work?
If your labor does not progress, or if you and your fetus are doing well after attempting the induction, you may be sent home. You can schedule another appointment to try to induce again. If your labor starts, you should go back to the hospital. If you and your fetus are not doing well after an attempted induction, a cesarean section may be needed. This information was designed as an educational aid to patient and set forth current information and opinion related to women's health. It's not intended as a statement of standard care, nor does it comprise all proper methods and treatment of care. It is not a substitute for treating clinicians' independent professional judgment. You can refer to the ACOG on labor induction at 39-week episode Frequently Asked Questions 507.
Thank you.